Hi, I'm Dan Duffy. I am a retired internal medicine specialist in Tulsa, Oklahoma, and I am currently volunteering with the First Step program as the clinical supervisor. Welcome to our presentation tonight and panel discussion on the flourishing adult life, a positivist approach to recovery. This is a shortened version of a presentation we gave to the Zarrow Foundation earlier this year. Next slide, please, David.
Oops.
What I'd like to do, let's go back. One circle, which is green, we call criminal behavior or criminal thinking. And all of the persons in the First Step program have come to us through the criminal justice system. So they all have a problem with their criminal justice decision-making or criminal decision-making that has ended in their being incarcerated, arrested, and so on. The second common problem is a substance use disorder. Many of the crimes that these young men are involved in are related to substances, either use, distribution, or sales, and they therefore benefit from using treatment for substance use disorder. The third big problem is a number of them have mental health problems. Most of them are in the nature of dysregulation of emotions, but some may have more serious problems such as generalized anxiety disorder or depression. These three circles, which are very much interacting, some people have mainly one problem in the circle, others have all three. But they all occur in the context of intergenerational trauma and the development of life skills. All of the men who come to our program have had trouble in their growing up. That trouble either occurred in their childhood at home, they have high adverse childhood event scores, or they had trouble in school with the socialization of school and had a dropout and so on. As a result of that, they have not developed the life skills they need to be flourishing in adulthood. So we could come up with four concepts that become really important in the First Step program. The first is the concept that comes from human or positive psychology, which is the concept of human flourishing. And this replaces the idea that we are treating diseases or dysfunction or we're rehabilitating criminals. What we're attempting to do is help people develop the skills, attitudes, and knowledge that are needed to have a flourishing adult life. The second big concept is that of emerging adulthood. And what we've come to realize is that in the stages of human development, we go through our infancy and childhood stages and reach adolescence, where we begin to emerge as an individual, experimenting to find our way in life, and then we move on into adulthood. What we've come to realize over the past several years is that this adolescence from 12 to 18 actually extends well beyond the 18 cutoff point into at least age 29 or 30. And to accommodate that idea, Arnett and others have come up with the idea of emerging adulthood. So if we limit adolescence to 18 or 12 to 18 and consider that to be a growth and development stage, we then can have a stage of 18 to 28 that we call emerging adulthood, which is actually the end of adolescence and the beginning of adulthood that overlap. And that has important implications we'll talk about later. The concept of recovery, I'd like us to think of as a healing process that is applied to crime, in which case, when crime goes away, an individual experiences desistance, or recovery from crime is the phenomenon of desistance, where the person inclined to crime stops performing the crime or reduces the severity of the crime. Substance use disorder is a disease, we now know, and recovery is the usual term that's used to describe getting over the substance use disorder and being able to live a sober and happy life. I'd like us also to begin to apply the word recovery to the change in emotional and cognitive symptoms that occur from lack of emotional control and the development of cognitive skills. The fourth term that we've come to recognize in First Step is important, is habilitation. We've come to realize that with these young men, we are not so much rehabilitating them, that is, returning them to a way of life that was disrupted through their criminal behavior or their substance use disorder, but in fact are teaching them how to develop the skills, attitudes, and knowledge necessary for human flourishing. Next slide, David. So, what are the human flourishing indicators? What do we mean by that? First of all, it means health, and we believe in the World Health Organization definition of health as a state of complete physical, mental, and social well-being. It is not just the absence of disease. Positive psychology has emerged as a new scientific study of the strengths that enable individuals and communities to thrive in life. And we find that so much more useful than the pathologic approach, that is, identify diseases and come up with a treatment to eradicate them. When we look at the meaning of flourishing, we realize that it's a state of complete human well-being, and all things are good in a person's life. And using the flourishing definition that Vanderwille and others have described, we've divided that into material and financial stability, mental and physical health, having close social relationships, developing character and virtue in our behavior, and developing a meaning and purpose for life. And we've come to believe that those five attributes will lead us to happiness and life satisfaction. Next slide, please. One of the models that we found very helpful in explaining and trying to understand the crime, the pathways to crime, and the turning points that lead people away from crime or into desistance is described by Sampson and Loeb's age gradient theory of informal social controls. So let's dive into this a bit. I've already talked about the stages of human development. And in the top part of this diagram, we show childhood, adolescence, then this transition to young adulthood, which we're calling emerging adulthood, then young adulthood, that we show as 28 to 32, and then the transition to middle adulthood. As we look at this, and next slide, please, David. Just one. Thank you very much. As we look at the biological and structural changes that occur in a person's life, we know that the low family socioeconomic status, large family size, or very disruptive family, problems within the family definitely occur, as well as epigenetic trauma that passes from one generation to the next, as well as social trauma characterized by the ACE or adverse childhood events. These traumas definitely affect the growth and development of the child, and they are superimposed on the natural temperament of the child or other early childhood experiences. Next slide, please. Then we move into the socialization that occurs in school, and the problems that or the influences there are friends and their influence on the individual growth and development of the human being, and there's socialization in school, how they learn in school, how they get along in school. And we see in many of our young men in the First Step program, they have low self-esteem, have had peer trauma superimposed upon their family trauma, and even in adolescence and in their school age, they have a high stressed life. Moving to the next slide, we reach adolescence, and in the Loud model, they suggest that this is where the adolescent who's exploring his independence and moving out in experimentation, developing new relationships, trying exciting new things, particularly drugs, we come into the opportunity to break laws and enter the criminal justice system. Drugs, guns, mental symptoms, peers and gangs all have a strong influence here. Interestingly enough, in our criminal way of looking at things, we have juvenile justice, in which there's a lot of forgiveness for the behavior because the child or the adolescent is believed not to have the mental capacity to have self-determination of what he or she is doing. We now realize that independence of thought and able to make rational decisions doesn't just end miraculously at 18. It takes a while for the brain to continue developing in this transition of the emerging adult. Next slide, please. So what we realize in the emerging adult, we have a group of young men who have habilitation failure, early pregnancies and starting families occurs, which disrupts the normal growth and development. And these young men have found themselves lacking in skills, having only availability of low-wage, low-skilled jobs. And so it's in that context, it's at this arrow that the First Step program comes and attempts to make a change in these young men's lives. Next slide, please. And according to the Log model, substance abuse kicks in, mental illness kicks in, plus the stigma of crime and poverty really lead to a destroyed or disrupted life for the rest of that individual. Next slide, please. So a couple of things I want to point out is the importance of this young adult or emerging adulthood. Next slide. You can see that the peak of both violent and nonviolent crimes occurs during the years of emerging adulthood. This has been known in the criminal justice system for years as the age crime curve. Next slide. The other thing that occurs is that there's a prevalence, highest prevalence of mental symptoms occurs in the 18 to 25 age group, and the next highest in the 25 to 49 age group. So as we look, so we know that crime occurs naturally at this period of time, mental illness occurs naturally at this period of time. So something is going on there, and we now know that the main thing that's going on is the growth of the prefrontal cortex, which is permitting the individual to make better choices, avoid substance use that distorts the growth of the brain, and receive help with the growing up. Next slide, please. So let's deal with recovery as a concept of healing. And I'm going to ask you the question, is recovery healing a disease, or is it adult habilitation? And I'm going to make the argument that it's adult habilitation, not really healing a disease. And as I've already mentioned, we think of recovery in three broad areas: crime recovery, substance abuse recovery, and mental illness recovery. And crime recovery, as we've used the word desistance, which is used in place of it is used as a way of measuring the success of a recovery program. And there are three broad areas. We want to support identity projects. Remember, this adolescent and emerging adult are really developing their identity as an adult. And that means they're developing relationship with an intimate partner, developing a parenthood identity, a career identity, and an identity as a citizen. There's also importance for spiritual transcendent being, having a relationship with a power greater than oneself, being a good friend, brother, son, uncle, and a destigmatized person in society. So this identity projects become critical, and that's what First Step helps these men do. The second is we have to change the peers in the neighborhood of the individual. And this is a challenge in dealing with cell phones these days, the internet and social media. We apply house arrest and GPS monitoring as two techniques to help the young men change their peer associations. And lastly, we work on the enhancing flourishing. This means helping them develop these life skills for material and financial stability, getting a good job, moving into a career, helping them with mental and their physical health, usually through counseling, developing close relationships. We've realized that parenting and co-parenting relationships with the mother of their children is critically important. We work on virtue and character with the individuals, realizing that they have a choice. As this prefrontal cortex in the brain is developing, it begins to make choices and allows the individual to make these choices between the vice or the virtue that make up their character as a purposeful and meaningful man in a good life. Next slide, please. We do address substance use disorder. Very interestingly, most of the diversion program, criminal justice diversion programs focus on treatment for substance use disorder, which is very common in young people with interaction with the criminal justice system, but not all have meet the criteria for an addiction. Recovery treatment is used if the individual does have a substance use disorder, and that involves residential intensive outpatient treatment, community support group, such as AA and NA, and when necessary, particularly for opioid use disorder, medication-assisted treatment. We urge the men to develop a sober and serene identity as part of their identity projects by either becoming members of a 12-step group or other spiritual development for their life. And we insist on sober living situations, at least for the duration of the program. Next slide. When it comes to emotional and cognitive well-being or recovery from emotional distress, we use individual group counseling, cognitive behavioral therapy, dialectical behavioral therapy, moral recognition therapy, anger management, and other methods. We use the medication-assisted treatment. We are very focused on trauma-informed habilitation and treatment. One of the things we've realized over the years in the First Step program is that many of the criminal justice informed methods of transition actually re-traumatize individuals. And lastly, we focus on the development of virtue and character, developing temperance, humanity, courage, justice, wisdom, hope, and transcendence. Next slide, please. So in summary, habilitation is all about learning the habits for a good life. These are learning life skills, material and financial stability, basic knowledge. All of the men get their GED, creating turning points for socialization, developing primary relationships with a life partner, fatherhood, career preparation, and paying attention to the cultural dynamics and religious engagement of their life history or where they plan to go with their own life. Developing emotional intelligence and social communication skills is at the heart of emotional well-being. And I'll say again that the identity projects are critical. Developing values, virtues, and character, getting a purpose and meaning for life, a secure place in the family, community, and society, and becoming law-abiding citizens and non-stigmatized criminals. David, I'd like you to stop the sharing at that point in time, and we'll turn this over to Lindy. Thank you very much for your attention. And we'll be happy to answer questions in the question and answer session.
Hi there, my name is Lindy Myers, and I am the First Step Deputy Chief. Again, today we are presenting our holistic approach to supporting justice-involved individuals on their path to transformation. Some key areas, focus areas that we have found important are mental health. We prioritize emotional well-being and resilience. Criminal behavior, we want to reduce recidivism and promote positive change. Substance use disorder, we support recovery and offer resources to combat addiction. Life skills, we believe essential skills are necessary for daily living and long-term independence. And environment, we want to create a supportive and structured community. Some key assessments that we use that we have found helpful are the ACE. The ACE helps us understand early trauma. We use the Casey Life Skills Assessment, which is necessary to build essential life skills. We use the biopsychosocial, which examines an individual's biological, psychological, and social factors. We use the ORAS, which is to assess the risk and thinking patterns of an individual. We use the habilitation and desistance assessments as well. With these, we're able to provide a structured approach for reducing reoffending. Understanding trauma and its impact. Unfortunately, trauma is common in justice-involved populations. It plays a significant role in shaping behavior, cognition, and decision-making. Without intervention, trauma can drive cycles of reoffending and substance abuse. The ACE assessment helps us identify each individual's trauma behavior, and it guides us in creating safe, non-re-traumatizing intervention plans. At first up, we have coined the term ITM, which is the interpersonal transformative motivation, the ITM approach. This is a multi-dimensional meaning. It targets the whole individual. Some key components of this are education. We are giving our individuals the information they need to make informed decisions. We give them support. We provide cognitive, emotional, and practical support. We provide access. We ensure individuals have active roles in their recovery. We incentivize. We are heavy on motivating with rewards for positive change. We use interventions, which address antisocial behavior with appropriate consequences. And we promote accountability and redemption. We encourage accountability and belief in personal growth and redemption. Each component, again, is tailored to meet individuals where they are, empowering them to make a lasting change. The role of trauma-informed assessments. Again, a trauma-informed approach is important. It includes trauma-informed assessments that form the basis of a personalized recovery plan. We use, again, the biopsychosocial, which evaluates the overall physical, mental, and social health of an individual. The Casey Life Skills helps us to identify the skills that the individual needs to develop necessary for independence, and substance abuse treatment. Again, those tailored to each client's specific needs with options for group and individual counseling. An overview of the habilitation assessments that we use. Again, there are 5 domains that Dr. Duffy had mentioned before. The material and financial stability, we use this to assess time management, also housing, money management, and safety. We also evaluate how well the individual takes care of themselves, as well as transportation and housing. The second domain, mental and physical health, we review coping skills, problem solving, and substance abuse. Close social relationships, we identify relationships and family dynamics, as well as communication skills. Virtue and character, we promote community engagement, legal navigation, and moral character. And purpose and meaning in life, we are encouraging productivity, societal contribution, and hope. This assessment is big as it can help us guide in creating a personalized roadmap for an individual to grow in each of these areas. The desistance assessment, again, the purpose of this, it'll evaluate the key life areas that help the individual or influence the individual of participating in criminal behavior. The assessment areas include education and employment, financial stability and housing, legal history, substance use and citizenship, family relationships, health, and life purpose. Based on assessment results, one can tailor a development plan for each individual. This again includes financial literacy, communication skills, problem solving. These are, again, critical for navigating daily life. This includes trauma-informed interventions. We want to ensure a safe environment, reducing barriers to skill development. We also are big on furthering education or vocational training. This helps the individual with employability and financial stability. The aim is to create a cycle of continuous growth with regular assessments and support that is always adapting to the individual's changing needs. In summary, let's cover these elements. We have safety and stability, we have meaningful relationships, we have self-actualization, and we have resilience. Let's first look at safety and stability. One of our primary goals is to create a trauma-informed environment that ensures our participants feel safe and secure. For many, the sense of stability begins with having a reliable and comfortable place to live. Trauma-informed assessments help us identify each individual's needs so we can again provide safe, stable housing and a secure foundation, which are essential for positive change and personal development. Next, let's look at meaningful relationships. Our group therapy sessions and support networks play a vital role in helping participants build positive connections. These relationships foster a sense of belonging, which can be transformative, especially for those who have never had a strong support system in the past. Creating these meaningful connections is crucial for emotional growth and for developing healthy social habits. Self-actualization is the process of helping each individual realize their full potential. Through a variety of tools and personalized support, again, we work with participants to identify their strengths, set goals, and actively pursue them. We empower individuals to tap into their unique abilities. We see them make meaningful strides toward their personal goals and becoming the best version of themselves. Finally, let's talk about resilience. Many of our participants come from challenging backgrounds, so addressing trauma directly is key to helping them build resilience. Our program provides strategies to face and overcome obstacles, cultivating a mindset that can handle setbacks and persevere. This ability to bounce back is essential for long-term success and well-being. To support these components of the human flourishing, we've developed a few core strategies. Our first strategy is individualized interventions. Based on comprehensive assessments, we tailor each intervention to address specific needs and strengthen the areas we've discussed. We believe this approach helps us support participants where they need it the most. Our next guiding principle we use is the STICK approach, which stands for safety, trust, incentivization, and kindness. These principles ensure that participants feel respected, motivated, and supported throughout their journey. Finally, we have comprehensive support. We offer a range of life skills classes to help participants thrive in all areas of life. These include work readiness, nutrition, financial literacy, parenting skills, the Strong Dad Support Group, PRS classes, anger management, time management, and substance abuse treatment. Each class provides valuable skills promoting both independence and self-sufficiency. In conclusion, our goal is to create an environment where each participant can truly flourish. By focusing on safety, stability, relationships, self-actualization, and resilience, we're building a foundation for long-term success. I'd like to thank you all for your attention, and I'm happy to answer, as well as me or Dr. Duffy or David will answer any questions you have about our program and our approach. Thank you.